Yesterday, I posted this little headline and it caused quite a stir. You know, there are people that feel very strongly both ways around these new drugs, these weight loss injections, these GLP-1 receptor agonists. And the concern is that, either it's fear mongering or perhaps we're not catching all the problems that are going on. And so how many people are having complications? How many people are actually dying? How many people is it preventing from dying? Because, the counter argument is, well, these people are obese or diabetic and they would have greater complications without the drug. And so this is the calculus that people go through. Now, the problem with this, and I made this simple question. I said, hey, if you work in an ER, how often are you seeing people present with these type of complications? And the second question, which is probably the more important question in my mind, is how often is it getting reported? And so the answer, as you might expect, there's a lot of people chime in saying, yeah, I had a complication, I didn't like it, I hated the drug. A number of healthcare providers chiming in saying, we see a lot of complications. Some say they don't see that many, so it's kind of a mixed bag. But the real problem is when I say how many times does it get reported, and there is a federal program that is supposed to be for catching all of these serious adverse events. It's called MedWatch. The reality is that it almost never gets reported. It's estimated that less than 1% of serious adverse events associated with drugs ever get reported. And so the question is, how do we know? How do we know how many problems? Now, are we supposed to rely on the pharmaceutical companies to be forthcoming with their data and to be fully transparent and truthful with how many complications are occurring? We know that isn't the case. We know that they lie. We know that they skew their data. They do that for marketing purposes to get it approved and for post-marketing or post-production marketing purposes, right? Oh, we sell television. Look at these great outcomes. And if that data is not performed in good faith, and unfortunately we have a revolving door at the FDA, we know that's going on. How are we supposed to know, as a physician who might prescribe this, how are we supposed to give a good informed consent to our patients, when the numbers could be questioned? And so this MedWatch thing, right? So what physicians don't want is more paperwork. I get it. I hated doing paperwork all the time. It's one of the most unenjoyable tasks of being a physician. We all hate it. The problem is, and it's not really a problem, every time you go to the physician's office, you go to the ER, anywhere, they always track what medications you're on. Can you remind me the last time you went to a doctor's office, they didn't ask you if you're on any medications? And if you said yes, they wrote them down, right? So we always know what medications people are on. We always have a chief complaint. We always know what they're there for, right? So it's not that hard to marry those two electronically. All this data is being captured electronically. We know what medications people are on. We know what events they're having. It seems like it would be a very easy task to write a software program where that data is automatically, compiled and set up, and then you can analyze. Hey, if for some reason every time we see all these people with severe gastroparesis, and we notice that 60% of the time they present with one of these drugs, then we have a better idea of how frequently this is causing or pancreatic cancer or suicide or thyroid cancer or pancreatitis or bowel obstruction or blindness or any of the other events that we've seen so far. Right now it is up to sort of random chance that someone's going to report it. It's such a small amount. It needs to be mandatory, in my view. It needs to be mandatory for all newly approved drugs that go on the market. This should not need to be questioned. This just seems like a straightforward way to do post-market surveillance for side effects, so we can get an idea if these drugs are truly safe or not, how many people they help, how many people they hurt, and at the very least, so we can at least give true informed consent to our patients. Because once again, the drug companies do not release their data. It's historically factual. We've seen that time and time again, so we can't trust these guys, right? Anyway, let me know what you guys think. Talk to you soon.